end of this lecture, the students will be able to define infanticide, feticide, stillborn, deadborn, maceration, fetal age estimation, sign of live birth, and the criminal causes of death of a newborn baby. That is act of commission and act of omission. This is infanticide means unlawful destruction of a newly born full-term viable infant up to 1 year of age after birth. It is punishable under Section 302 PPC, although most of the newborn babies are destroyed within few hours after birth, but in this law the condition is up to 1 year, 12 months after birth. Feticide is the destruction of a fetus at any time prior to birth. Neonatal is the destruction of the child in the first month of life, and filicide is the deliberate act of killing of a child by the parents, whatever the reason would be. And punishment of the infanticide is life imprisonment, fine, or death. Infanticide is different from ordinary murder as it is necessary to prove that the child was alive and viable at the time of birth, and criminal violence was applied to fetus after birth. According to English law Infanticide Act of 1938, the mother may not be held responsible for killing her child when her mental balance is disturbed by experience of labor and tension and strain of childbirth and its after effects. He is not charged and punishment is just 2 years of imprisonment. Motives for infanticides. First, very important, is to get rid of an illegitimate child of a widow or unmarried girl. Then married girls, they killing the female child to escape from the defame of not having a son. Then extreme poverty of parents like nowadays. Then killing of male child by prostitutes. In case of infanticide, it is necessary to examine a woman for sign of recent delivery and whether time of delivery corresponds with the age of the child to prove that the child belongs to her. Examination of the child is carried out to ascertain that was the child born dead? If so, was it stillborn or deadborn? Then was the child viable, mature or immature? Then was the child born alive? If so, has he breathed and extent of breathing? For how long did the child survive after birth? Then what was the causes of death, whether natural, accidental or homicidal? We will discuss all these things one by one. Does the child belongs to the accused woman? The proof is established by sign of recent delivery, or was the delivery compatible with the age of the child, the changes of the body in the female, the change in the breast and the genital tracts. And evidence from the people with whom the suspected woman has been intimately related, like at her work or social at home place, or by sweepers who collect the discharges from the houses like sanitary pads, which shows the stain of blood or discharge from the vagina and uterus logia because of recent delivery. You can have idea that the woman has delivered a baby recently. Medico-legal aspects are: was the child born dead? If so, was stillborn or deadborn? It is necessary to distinguish between stillborn and deadborn. Stillborn or still silent child is that who has delivered after 28 weeks, that is the age of viability, and did not breathe or show any other sign of life, that is a stillborn child. Deadborn child is that who died within the uterus. Age should be above 28 weeks, like age of viability, and deadborn child shows the sign of rigor mortis at the age of 9 months before birth. If it appears before birth, then it makes the delivery very difficult. Then signs of maceration, adiposity formation, there may be mummification or putrefaction of a dead child inside the uterus. When fetus dies in the uterus, aseptic autolysis of the fetus commences. Although the body is sterilized and no bacteria are there, even then autolysis occurs. If dead fetus is in the uterus surrounded by the liquor amnion and they remain there for 3 to 4 days, then signs of macerations occur. Presence process is aseptic because the child enclosed in membrane and is in aseptic sterile condition. When membranes rupture, air enters into the membranes and which causes the infection and putrefaction appears. This is maceration. The one of the sign is the peeling of the epidermis and brown discoloration. What are the findings of maceration? Body is softened, flaccid, and when placed on the table it flattens out. It emits an unpleasant, disagreeable odor which is different from putrefaction. The skin is brown or black and not greenish as in putrefaction. Cuticle is raised in blister containing red serous fluid. Epidermis peel easily, leaving moist and greasy patches. Bony junctions in skull and joints, they are abnormally mobile. Skull bone sutures, they are separated and override each other. This may be mistaken as a crush injury of skull. Internal tissues are soft and edematous. Turbid red fluid collects in serous cavities. Important radiological sign here is known as Spalding sign, in which there is an overriding of skull bones even when fetus is in the uterus. This positive sign shows that the fetus is dead. Brain is grayish red, pulpy mass, pulpy mass. Umbilical cord is soft and smooth, thickened and is easily lacerated. Histological examination reveals the degeneration of nuclear structures and disintegration of cells of muscular tissues and internal organs. This is a Spalding sign. You can see this is an ultrasonogram of a pregnant lady. The fetus is inside the womb and this is overriding of skull bone. This is called Spalding sign, which is the positive means intrauterine death of the fetus is confirmed. Roberts sign is another sign which appear after 12 hours of death, and it is the appearance of gas shadow in chamber of heart and great blood vessels. It may appear after 12 hours, but it is difficult to interpret, so not important. There may be hyperflexion of spine and there is a overcrowding of ribs shadow with loss of normal parallelism due to in case of dead fetus. If we not examine soon after expulsion of dead fetus, then superimposed on maceration is putrefaction, which masks the sign of macerations. And if the baby is not delivered soon after death, then the air get entered through the genital tract, like get infected, and fetus undergoes putrefaction instead of maceration. What are the findings of putrefaction? It has a nauseating, unpleasant odor which is different from maceration. The color of the body becomes greenish, rather brown or black. The formation of foul-smelling gases is always there in putrefaction, which are not present in maceration. Findings of mummification. Fetus is dried and shriveled up, result from deficient blood supply, scanty liquor amnion, or no air enter in the uterus, so it becomes dried. This is a mummification of fetus, become dry, shriveled. Then was the child viable? Fetus of less than 7 months of intrauterine life is non-viable if fetus is not mature and chances of being born alive is deprived by mother, then charges against the mother is less serious than when the fetus is viable. So age matters a lot. Meaning of viability of infant is physical ability of a fetus to lead a separate existence after birth apart from its mother. Legally, the age of viability is 30 weeks, 210 days, or 7 months. Fetal age determination. How we determine the age? Either he was at the age of viability or not, because it depends on it matters for the punishment. If it crosses the age of viability, then which are infanticide. If it is not, then the crime is not that much serious and punishment is less serious. The most important in calculation of age is the rule of S. It determines that in first 5 months of pregnancy, age in months is equal to square root of crown heel length. It means this crown to heel length in centimeters. We measure this length, and then we take the square root of it. The number which result is equal to the number of age in months. Okay, like if the length of the baby is crown heel length is equal to 9 centimeter, the square root is 3, so the age would be 3 months. This we take in first 5 months of pregnancy. In the last 5 months of pregnancy, we calculate as age in month is equal to crown heel length in centimeters, which is divided by 5. We take the same crown heel length in centimeters after the age of 5 months of pregnancy. If it become 35, length of the fetus is 35 centimeters, then we divide it by 5. 5 6 are 35. So the age of when the length is 35 divided by 5, the age of the baby will be most probably 6 months. Appearance of ossification center, we can assess the age of child or age of the baby fetus. Ossification center of calcaneum, it appears at the age of 5 months, and ossification center of talus, they appear at the age of 7 months, that is the age of viability. Then ossification center of cuboid, capitate and lower end of femur, they appear at the age of 9 months of intrauterine lives, and ossification center at the upper end of the tibia, it appear at full term, about to deliver 10 months of intrauterine life. Here this is calcaneum. Ossification center appear at the age of 5 months, in talus at the age of viability 7 months, cuboid at the age of 9 months. In here lower end of femur, ossification center appear at the age of 9 months of intrauterine life, and in upper end of tibia it appear at the full term or at birth. This is the ossification center of calcaneum at the age of 5 months. This is ossification center of the lower end of femur, which appear at the age of 9 months of intrauterine life. See, another thing which is important is the weight of a baby, from which we can calculate or assess the age of the baby fetus. Weight of unborn fetus of 20 weeks is up to 400 grams. From 20 week onward, for every 1 week there is increase is 100 grams up to 36 weeks. From 20 weeks to 36 weeks, the rise in the weight is about 100 grams per week, or every month there is a rise in weight of 400 grams per month. Okay, this is up to 36 weeks. In the last month of the pregnancy, means after 36 weeks, every week rise of weight is twice, become double, means 200 grams per week. And in the last week, it may increase up to 1 kilogram. Wernicke gaseosa is a white cheesy substance covering the skin of the fetus. It is made up of sebum and desquamated epithelial cells. It is visible on the body from the 5 month onward. This is all cheesy material. This is the Wernicke gaseosa, which appears on the body after the age of 5 months of intrauterine life. Second thing is lunago hair. These are the fine unpigmented hair on the body of a fetus or newborn. These are fine golden unpigmented hairs. They appear visible on the body at the age of 4 months of intrauterine life, and they become visible on face at 8 months of intrauterine life and remain only on the shoulders at the age of 9 months till term. At the time of birth, the babies mostly have the golden hairs on their shoulder. They are lunago hairs. Then there is a correlation between the presence of meconium in the intestine and the age of intrauterine age of the fetus. What is meconium? Meconium is the earliest stool of the infant. It is a mixture of bile, mucus, and shredded mucosa. It appears at the age of 4th month of intrauterine life. It is present in the upper part of the small intestine. There is the upper part of the small intestine. There you start the large intestine. So meconium is present in the upper part of the small intestine at the age of 4th month of intrauterine life. At the age of 5 months, it occupied the beginning of the large intestine. From small intestine, it enters into the first part of large intestine. Okay. Then in the 6th month, it is present in the upper large intestine, upper part of the large intestine, occupied by the meconium at the age of 6 months. And at the age of 7 months, the entire large intestine, entire large intestine is filled up with meconium. And 9th month, it is present only at the end of large intestine. At the end of 9th month of intrauterine life, meconium is found at the end of the large intestine. And at the full term, at the time of birth, meconium was present in the rectum. That is the first stool the baby passed. After that, we have to know whether child was born alive. There are two evidences, one circumstantial evidence tell us whether the child was born alive if someone is witness of delivery or have seen the baby cry. These are the circumstantial evidences. Or the second authentic way is that by a doctor doing the postmortem. Circumstantial evidence is taken in civil cases. Witness who saw the child having muscular movements, twitching of eyelids, hearing heartbeats and cry, like the nursing staff or the person who was present attending the delivery, can be a witness of that delivery. Then pulsation of cord, umbilical cord after child born is evidence of live birth. Child may cry in the uterus or vagina during the delivery process of delivery when the one part is inside the mother's birth canal. If the child cries in uterus, that is termed as vagitus uterinalis, and if the child cries in the vagina, in the birth canal, then it is termed as vagitus vaginalis. In criminal cases, medical examiner is asked to prove by post-mortem examination that the child was born alive or dead. So then we proceed to post-mortem finding of an infant autopsy. Following points should be noted on post-mortem examination. First is a sign of establishment of respiration. Before birth, lungs received a very little blood supply, which is necessary. After birth, pulmonary circulation is established, and this produces the physical changes in the lungs and chest. Changes in the chest at the flat before birth or before respiration, and it is become arch shape after birth and respiration. Changes in diaphragm. Diaphragm is arched up to the level of third and fourth rib before respiration, while it descends to the level of sixth and seventh rib after respiration. Changes in the lungs. This is all about the changes in unbreathed and breathed lungs. In case when the respiration is not established, the lungs are small, they are tucked along the spines behind the heart. Their margins are very sharp, surface is even, and the consistency is very dense and non-crepitant, uniform and with deep furrows, and there is no mottling, just like a liver inconsistency. Color is deep violet and bubbles. If we cut under the water, then there is no bubble on squeezing. No bubble comes out when we squeeze in water. Okay. And blood, and on squeezing, the little froth of blood comes out from the lungs tissues. While in case when the respiration is established, the volume become up to 4 to 6 times more after respiration, and they become blown up and they covers the thymus and heart. They're not like unbreathed lungs, they are smaller and they are just confined to the back of along the side of the spines. While respired lungs, they are balloon up, they cover the thymus and the heart. Their margins are rounded and surface is uneven due to the expanded air vesicles, and consistency is elastic, crepitant, and modeling is present. Color become bright red from deep violet. It may be blue if collapsed. Bubbles if we cut or squeeze the lungs underwater, then bubbles comes out from the lungs. On cross section, there is a frothy blood comes out from the lungs. And about the weight and volume of the lungs, there's a ratio. Before respiration, the ratio of the lungs with the whole body is 1:70, while after respiration it reduces because of air to half, like it becomes 1:35 of the body weight of the body. To confirm the establishment of respiration, we perform a test which is hydrostatic test. Hydrostatic test, the principle is based on the fact that specific gravity of non-respired lung is 150, which is heavier than the water. Water specific gravity is 1, while the specific gravity of respired lung is 950, which is lighter than the water owing to increase in volume and due to the presence of air. So the non-respired lungs sinks into the water and respired lungs, they float into the water. What we do, the lungs are removed with bronchi, larynx intact and placed in a container containing water to see if they float. If they float, then each lung is separated and tested similarly. If both lung floats, then it means the respiration is established. But if the lung sinks, each lung is cut into 12 to 20 small pieces, then pressed to expel the gases of decomposition and again tested. Pressure is applied by means of thumb and fingers or by placing between two cardboard pieces and then place some weight on them to escape or squeeze out the air. When all portion of lung sinks, it means there is no respiration established. Lung may float. Sometimes some portion of lung floats after compression and some sinks. This is a proof of incomplete expansion of lungs and partial expansion. It may be due to artificial respiration. This is if due to artificial respiration, air may get enter into the lungs and it may floats on water. So it means it is positive, but it's false positive. It is termed as false positive. So these are the falsities of test. Falsities of test means unexpanded lung may float due to artificial respiration of putrefactive gases. This is known as false positive hydrostatic test. An expanded lung may sink due to disease as atelectasis or pneumonia, or maybe obstruction by alveolar duct membrane, or there may be a feeble respiration or emptying of air due to elastic recoil of lungs. In case of artificial respiration, baby does not breathe, but due to mouth-to-mouth breathing, these lungs become partially inflated and do not have mottled or marble appearance at all on them. Situations where there is no need of hydrostatic test. When the fetus is not viable, the age is less than 180 days. And when the fetus is menstrual, like having some serious congenital anomalies, anencephaly, or when it shows sign of intrauterine maceration already dead. When stomach has milk or fruit juice, which shows that the child did survive after birth, there is a sure sign of live birth. So we have no need to perform hydrostatic test here. Another test we perform, that is stomach bowel test or Breslau's second life test. When the respiration is established, the air gets into the stomach and intestine, they become distended. So when if stomach and intestine are distended, then we tie both ends and cut out from the body and place them into a container of water. If they floats in water, then it means the air is present in the stomach, or this is called as a Breslau's second life test. If positive, means the child was born alive. Another test is static test or FODER test. Means it states that the average weight of fetal lung is 450 to 500 grams. After respiration becomes double, 900 to 1000 gram. It is not used in practice because the weight may alter because of some disease, tumor, or anything. Another test is block weight test. Block weight test is for the establishment of respiration. The ratio of the weight of lungs and the whole body is 1 is to 70 before respiration, and it is reduced to half, become 1 is to 35 after respiration. This is the block weight test. So we confirm that the child was born alive by the positivity of all these tests. Then how long the child survived? For this, we see the changes in the skin, changes in circulation, changes in umbilical cord, presence of caput succedaneum, and fetal hemoglobin. Changes in skin. The skin of a newly born infant is covered with vernix schizosa, chiefly in the flexures of the joints and neck folds, which can be washed by giving birth to the baby. Then color of the skin is bright red at birth. It becomes darker on second or third day, and physiological jaundices appear between 7 to 10 days of life. Caput succedaneum is an edematous swelling on the presenting part of the head during delivery, which disappears from 24 hours to 7 days after birth, depends upon its size. It is due to the process of birth while the head is compressed in the tight birth canal, and mostly it is the prominent feature of first delivery, first and second delivery, never present on multipara. This is a caput succedaneum. You can see here there is swelling on. This is the present part during the delivery of the baby. There are subcutaneous tissue. There is swelling, collection of edematous fluid is there. This swelling is termed as caput succedaneum. Now the changes in the umbilical cord. Clotting occur in cut end of umbilical cord after 2 hours. Desiccation of umbilical cord on the first day. Drying commences at the free end. The inflammatory zone near attached end is appear in 36 hours. The cord mummifies in 3 days and complete in 5 to 6 days, and cord falls off, leaving a raw area. The complete cicatrization in 3 weeks. The circulation few hours after birth, lumen of umbilical arteries shrinks. The contraction along whole length in next 2 to 3 days. Ductus arteriosus is obliterated in 7 to 10 days from an ovale close by second or third month. Fetal hemoglobin at the time of birth. 55 to 58% of hemoglobin is fetal, which is replaced completely by adult hemoglobin by the age of 6 months of life. This child has been born alive. If the child is able to live independently, means the age of viability, lungs fill the thoracic cavity, color of lung is bright red and mottled, lungs or position of lungs after squeezing float in water. Blood-stained frothy fluid exude from cut surfaces of lungs. On application of pressure, fine bubble escapes. Microscopy show the expansion of alveoli and their patency. This is all about the positive hydrostatic test. Child has survived birth for enough time when there is evidence of change in the umbilical cord, when there is a food in stomach, or the condition of umbilical cord, presence of jaundice, and desquamation of the skin. Then causes of death. Natural, there may be natural causes, accidental, and criminal causes. Natural causes, unnatural, or accidental and criminal. Accidental causes may be prenatal before birth, may be postnatal after birth. Unnatural causes are another is criminal cause. Criminal cause may be the act of omission and act of commission. Natural causes are prematurity, post-maturity, may lead to death, birth trauma, it may be very serious, may result in death of the baby, Birth asphyxia may there in prolonged labor, and neonatal infection early respiratory distress syndrome is there. Congenital malformation may result in death of the baby, cannot survive, and there is ABORH incompatibility may result in UGR and death of the infant. Sudden death infant syndrome is another cause of is a natural death. Accidental causes during birth is a prolonged labor, prolapse of cord, knot or twist in the cord, which may hinder the blood supply to the baby, may result in death of the fetus before birth. Then premature separation of placenta, that is termed as abruptio placenta, same IUGR and death of fetus. Death of the mother may result in the death of fetus. After birth, there may be suffocation. There may be a suffocation or precipitate unconscious labor. Okay? Precipitate labor is a condition when the child is born without mother's knowledge. During passing stool or while walking around, the fetus falls out, resulting injury to the fetus with fracture of skull. There is no capital because it appears because of difficult labor when the birth canal is very tight and a first delivery. And this precipitate labor is mostly with the multipara, never in the primary gravida. Multipara when the birth canal is legs and the child is of very small size. Then criminal causes may be the act of commission, that is the use of mechanical violence and poisoning, and act of omission or negligence. Act of commission is that death by violence taking place in infants is seen as in adults. Certain factors predominates are suffocation, smothering, strangulation, drowning, fracture of skull, fracture and dislocation of cervical vertebrae, pithing, and poisons. They all are the act of commission. Suffocation is the commonest method of infanticide. It is done by pressing the face on pillow or bedclothes, or by closing nose and mouth by clothes and hands. Use of hand for this is known as smothering. This is the commonest method of killing infants and can leave no trace unless force is greater than necessary. In the absence of violence, there may be nothing to prove that the death was due to foul play. Second is strangulation. Strangulation with ligature, umbilical cord or cloth, and rarely with hands. If hands used, then fingernails may be present on the neck, and this is termed as throttling. While the strangulation is by the encirclement of the umbilical cord around the neck of the baby, then there is a difference between the cord around the neck inside the uterus, because if the encirclement by the umbilical cord is with the criminal intention, then there is a Wharton jelly displacement is markedly, and there is a on dissection there is extravasation of blood underneath the skin. There this is the positive towards the criminal act. And if the encirclement of cord occurs in the uterus, there is no extravasation of blood under skin and there is no displacement of Wharton's jelly of umbilical cord. Then drowning in water or in milk. Not necessary that the whole body of the child should be immersed in the liquid. Immersion of nose or mouth or both is sufficient for death. Careful examination of the fluid from the lower part of bronchial tree shows the presence of foreign body, not just the mucus or edematous fluid. Fracture of skull. It may be accidental in precipitate labor or in unconscious delivery. On examination in case of precipitate labor, we find injuries as the child falls down, fracture or hematoma. In difficult labor, fracture may be there, but it is characterized by the spoon-shaped compression or minor fracture of parietal and frontal bones without laceration of skulls. Then, in case of difficult labor, capital is always there and is very marked. Fracture and dislocation of cervical vertebrae, they produce by applying criminal violence to the neck, and it may be present when the forcible rotation of the neck to correct the position of head during birth or to extract the head in breech delivery. So there may be a difference. So you have to find out the signs of violence on the neck. We think these are injuries such as cuts or stab wounds. The punctured stab wound by needles, pins, scissors may penetrate the lungs or heart. The puncture of inner canthus of eye, then fontanelles, laceration of eye, they can cause infanticide. And they are also very common method to use for the infanticide. Poisoning. Opium was used in past. Arsenic, madar and dhatura, they used for killing of a newborn. If the case is suspicious of poisoning, then viscera should be preserved for the chemical analysis. Then the act of omission. Act of omission means negligence. The law presumes that a woman about to deliver should take delivery precautions to save her child after birth. She is charged with negligence if she does not take care that necessary help of doctor and nurse, then inform her relatives to take care of her and her baby, then failure to tie a cord after cutting because it causes fatal hemorrhage. Omission to remove the child from the mother discharge, which may result in suffocation, to save the child from heat and cold, omission to feed the child, which may result in starvation and death, separation from mother may cause shock. The woman should make provision for birth of child. If she doesn't, it suggests that she had a bad intention unless she was unaware from the birth, like fainting due to sudden pain of labor can be excused from these things. Concealment of birth in case when infanticide is not proved. Okay, we cannot prove that the killing is of the infant is by the criminal act of violence, then mother is charged with a less offense of concealment of birth. Concealment of birth act is that section 318 ppc. Whoever by secretly burying or otherwise dispose of the dead body of the child, whether such child dies before, after, or during birth, intentionally conceals the birth of such child is punishable for this offense. This concealment of birth is a crime and for which they charge, but it is a less severe as compared to infanticide.